drastically. Hospital medicine, we're discharging sicker patients, we're seeing sicker patients, a lot more referees around, a lot more data collection. We have report cards. I don't know whether it's gotten more difficult or less difficult, but I think we've become more effective over those years. I think that's a good thing.
Oh, absolutely. A lot different from when I was in training. So that's part of why I'm here to, continue to stay up to date with the information.
It's gotten bigger. There's more of a presence. But really, one of the biggest things that has happened with hospital medicine is really combining with other service lines that are actually provided in the hospital with other. So companies are doing a lot more vertical integration, as they call it. So emergency medicine, hospital medicine, anesthesia, critical care medicine, and OB hospitalists, and we're actually providing hospital medicine across many different service lines at this point. And that's been the biggest change, in my opinion, over the last 15 years.
There's definitely, I think, a bigger push for high-value care. I'm an academic hospitalist, so I do a lot of teaching of med students and residents and trying to make sure that we educate them appropriately using evidence-based guidelines, much more clinical practice guidelines as well.
Well, it's actually evolving very rapidly. We are among the most important stakeholders for impulsing evidence-based management and high-value care across not just the hospital, but the healthcare continuum. And so it's a continuous improvement that is always present.
Hospital medicine has changed so much. I think we've developed a lot of expertise in different areas. We've branched out. We've looked within the hospital. We're now looking more outside the hospital. I think there's just been continual growth, of course, in the number of hospitalists nationally, but also in the roles they play in the hospital and outside the hospital.
Well, when we initially started, it really wasn't, it was more like we're just filling the role of the outpatient provider in the hospital. But over the last few years, I've seen more development in actually getting involved in what goes on in the hospital policies, improving the way we care for patients, actually forming a structure around it and not just, well, my pediatrician can't come into the hospital, you take that place. So I really like that part of it. So it's become more structured, and it's definitely more, there's a future in it. It's not going to stop if the pediatricians want to come back into the hospital. So I like that.